welcome you all to the kind of informational session for Research Boot Camp. I'd also like to welcome our partners, Charleston Area Medical Center, and people from the West Virginia School of Osteopathic Medicine. As you probably know, we just received a large grant from the NIH, a clinical translational research grant. And along with matching funds, the total is $53 million that we can play with for the next 5 years. And this hopefully is a renewable type grant, and hopefully we can carry on the tradition that we're starting. So my name is Fred Manier, and I'm here to introduce a research boot camp along with Danielle Davidov and C. Davis, and they're both from the Department of Emergency Medicine. So research, this is just an informational meeting. The real boot camp will start next month, third Friday next month, and it'll go monthly as far as seminars. We're trying to do it to a two-prong approach to the research boot camp. One is we're taking a online PowerPoint information presentations that emergency medicine has been using for a number of years. Danielle and Steve have organized this very nicely. And so the residents in emergency medicine use this routinely. So we're taking something that we have, and we're going to add to that faculty seminars. These seminars will be monthly, and they will be recorded by Camtasia, so if you want to go back and look at them, you can go ahead and do that. I want to say right up front that I'd like to make this somewhat of an interactive session. If you have questions, however, please answer them. If you have ideas, please give them to us. This is still kind of a work in progress. Our idea basically is kind of try this for a year and see what happens. We welcome any input. Our contact information will be at the end, and please send us emails, stop by, talk to us. We're looking for feedback. So the objectives of Research Bootcamp are threefold. One is to stimulate clinical translational research throughout the Health Science Center. Now, you probably heard that NIH is putting a lot of money into clinical translational research. And 60 institutions out there have what's called CTSI grants. And a couple of people have CTR grants, which we have. Okay, so they have pretty much two objectives. One objective is to develop the next generation of clinical translational researchers. The second goal is to go out in the community and transform the healthcare and health of the individuals that the institution is supporting. In our case, would be West Virginia. We have a couple added objectives to our grant. One is we want to improve the infrastructure. So for instance, you know we have a cancer clinical trials unit, cancer CTRU unit. We're now developing a non-cancer CTRU for one. Number two is also in the next 3 years we want to recruit 24 clinician scientists to Health Science Center. And it's going to be very hard to do that because everybody out there is looking for the same person. So another objective of boot camp is we want to try to grow our own clinical translational researchers. Hopefully we can inspire a couple of you to get involved in this, and hopefully some of you will stay here and make a difference. The third objective is that we'd like to assist the residency and fellowship directors with their scholarly requirements they need for accreditation. So the idea is kind of centralize things if it works, okay? So what are the first things to do here? First of all, we'd love to have you join the West Virginia CTSI. And this is the address for it. It takes about 5, at the most 10 minutes to do so. The hardest part is why do you want to join? And that they ask you to write a few things, and what I would do is say who you are, what you do, and say you're participating, you're getting involved in research boot camp. And the guy two doors away from me makes all the decisions. If he grumbles about it, we'll get you in. So we want everybody to be a member. Why is that? Well, whether you are a member or not, and if you sign up in the back, we'll put you on the mailing list for upcoming events. So please add your name. Now, for those people, if we're talking to Charleston and Lewisburg, you might want to either email us or do kind of a get together as a group, and then go ahead and then email the names to us. Go back. Another really important thing I think to note is we have biostats walk-in clinics now. Danielle and Steve help the residents in emergency medicine set up their research, their plan, their data analysis, interpretation of stuff. Now, some of the other programs may have a person like that, but if you don't, you have the opportunity, especially if you're a member of the CTSI, you can do, we have walk-in clinics. They happen on Monday and Friday. You walk in, hopefully you'll be prepared, and we'll tell you a little bit about how to be prepared. But you walk in and take advantage of that free counseling, free advice. Another really important thing for boot camp is if you're going to do a project that's required for your residency or fellowship, is to find a mentor. It's probably the most important thing that I'm going to talk about, is find a mentor. Okay, and this mentor then, we'd like for that mentor to be approved by the program directors. Now, in the CTSI, we have a person, he's in the back of the room. Dr. Chad Higgins is the pathfinder for the CTSI. So if you're having problems looking for a mentor, or you want some advice on walk-in clinics or anything else, if you want some informational advice, Chad is your man. Okay? And of course, after you find a mentor, what you want to do then is develop a research project. And Danielle will talk more about that. Okay, so for instance, if you go to a walk-in clinic, it'd be nice when you walked in that you had a mentor, you had a project, you had some idea what you're going to do. Don't walk in cold. Walk in with some information, some background information. So what are the desired outcomes here? Well, these are pretty much, most of your programs require some kind of scholarly activity. And so basically, we want you to satisfy the requirements of the residency and fellowship program of your individual one. And some of these we would like to see abstracts for national presentations, published abstracts, publications, and whatever else is required for your program. So now I'd like to turn this over to Danielle. She and Steve have set up a very nice online PowerPoint presentation that you can follow to help you go step by step in helping you design a project and analyze it and interpret the results, etc. And basically, another nice thing about it is self-paced. So 3 or 4 o'clock in the morning, we have nothing else to do. You can find it online. Okay, Danielle. I'm going to do this.
Can you hear me? Okay. All right. Like Dr. Minier said, my name is Danielle DeVito, and I am the Research and Grants Coordinator in the Department of Emergency Medicine, and I work with Steve Davis. And I received my PhD in the Department of Community Medicine, which is now the School of Public Health here in 2010. And now I work in the Department of Emergency Medicine, helping residents and faculty do their research projects and satisfy their requirements for scholarly activity. So one of my jobs when I first started was to develop a curriculum of research for residents to follow and for faculty and fellows to follow if they wish, to kind of introduce them to research, how it's done, and really how to get a finished product out of their out of our mini research boot camp, which is what we kind of do in the department. And so we're kind of going to take that and apply that to this boot camp to help all of you guys get some products out of this endeavor. And so really we have it set up in a 3-year time frame. It might be more or less depending on your program. And the first year is really just getting you an introduction into research, getting your ethics training. The second year is actually doing the work, getting a project in motion. And then the third year, really writing that up and disseminating the results. And so just in more detail, first to do any research at WVU, you have to have ethical training. And so here we use a city training module. And so to go along with that, and to go along with many of the steps in the research project, Steve and I, have created some PowerPoint modules. They're self-paced. You'll be able to access them on the web, and it should be able to guide you through and kind of answer those questions like, what website do I go to do the city training? Which module do I select? Am I a social and behavioral researcher, or am I a biomedical researcher? So the purpose of these PowerPoints, which are in blue, will help you in each step of the process so that you don't have to go and ask 50 different people small questions, and you can actually get the process rolling. So that has to be done at WVU, and that's really the first step in any research with human subjects. Some projects that you might have ideas for, you might not need IRB training, but it's a really good idea, and most of you may already have it. And I have steps 2, 3, and 4 with little arrows between them because this isn't necessarily, the way you have to go about this process. You might have a great research idea and you want to know more about it, and you might want to turn it into a project, but you don't know who you should work with. So you might start with an idea and then conduct a literature search and see what's out there, see what should be done in the area, and then you go find a faculty mentor that you think can best help you with that project. Or you might work really well with someone, you know that they do really great research, and you want to pair up with them and together come up with a great idea. So you can do all of these steps in different orders, just whatever is easiest for you. And so there's a module that kind of introduces you to the steps of research, anything from how to develop a research question to the different types of measurement and survey questions that you may want to come up with. And so those are in 3 separate parts. And then there's a literature search module. I know a lot of the residents that come to me will say, I don't even know where to begin. I want to know about topic X, Y, or Z. Where do I start? And so this module will help tell you what are the best websites to look for scholarly works and articles, manuscripts, and tell you how to type in the correct search terms to get the results you want, so that you're not typing in a search that comes back with 3 articles that may be relevant, and you're not typing in a search that gives you 50,000 things to wade through. And so there really is kind of a method to the madness of searching the literature, and hopefully this PowerPoint can help you with that. So then in the second year, really, the goal is to have an idea solidified. You have a project that you're really interested in doing, you know all of the details, and you're ready to develop the IRB protocol and submit the IRB so that you can start. There's an IRB module that will accompany this step. However, we're currently in a transition from our old system, which was the BRAIN system for IRB protocols, to a new system called KC. And so that's currently in transition, so I'm going to wait for that to be finalized, and then that module will be available. And then, of course, you want to get your data, whether that's getting it from actual physical subjects or a secondary analysis of existing data. You will need to acquire that somehow. And then, of course, there's the entry, cleaning, and analysis process. And as Dr. Minier said, there are people to help with that. Steve and I are here to help our residents and our faculty with that process. The biostatistics walk-in clinics can take your data, ask you every question they have about it, and help you answer your research question in the best way. And so they will help with these aspects. So you're not required to open up a large data set and learn all these statistics through the course of your residency or fellowship. It's good to know many steps in that process, but you don't have to be overwhelmed that the onus is going to be completely on you for that. And to go along with that, there's a statistics module that kind of gives you an overview of the basic tests that will help you answer your research question. And then, of course, interpreting the data and your findings and writing up the results. So hopefully in the third year, the goal is to, of course, turn this project into an abstract that you can submit to a national meeting in your area. There are some regional meetings as well. And then here at WVU, the local meetings that we like our residents and fellows to submit to are Van Leer Research Day and GME, or Graduate Medical Education Week. And at the same time, you can start writing the results up into the form of a manuscript and submit it to a journal in your discipline. Okay. So the types of projects that, at least in our department, that we've successfully started and actually been able to publish have ranged anywhere from a medical records review of WVU hospital data to a secondary analysis of a large data set, such as the West Virginia Trauma Registry, or a very large database called the Healthcare Cost and Utilization Project, or HCUP data. And this data is discharge data from emergency departments and hospitals throughout the country. And the really great thing about this data set is that it can produce national estimates of ED visits. So if you're interested in how many ED visits are for any condition, we can kind of find that, and it's weighted to show national results. And so journals really seem to like that. You can do email surveys through SurveyMonkey or RedCap systems. And some of our residents will create an educational intervention, for example, maybe a PowerPoint giving more information about how to do an ultrasound technique. Having residents and faculty look at the ultrasound in the PowerPoints, giving that information, and seeing if before and after there's really any difference in knowledge or attitudes about ultrasound. And then there are, of course, opportunities for primary data collection here. And I'll say that this takes a lot longer than secondary data analysis, of course. But you can really get some good data and answer some really important questions. And I know none of you have 20 hours to go sit in the emergency department or approach patients in the hospital and hand out surveys. So one great resource we have is the Academic Associates Program. And this program started 1 year ago, and the School of Public Health and our department kind of worked together to offer a course called Clinical Research Methods and Practice. And this course has Masters in Public Health students and honors undergraduates enrolling in the course for 1 hour, learning about the research process, and then going into the ED 3 hours a week and collecting data. And so our residents and our faculty can come up with projects and then make the surveys, find out the information they want to get, and then we have people, actual bodies in the ED, handing the surveys out to patients. So it really helps with the time it takes to collect primary data. And so that's just one example of how, we've gotten around the time issue. Okay, go ahead. Now I just wanted to show you that with both of these routes, you can get data, you can publish in a short amount of time during the course of your residency or fellowship, or before you're trying to get to that next step in your career. So the HCUP data, the very large data set I was speaking about, we had a resident and a faculty team up, and they wanted to look at hospitalizations of older patients with HIV in the U.S. And so basically they queried this very large database and wrote up the paper, and it was published in the Journal of Emergency Medicine. And it's not advanced statistically, it's basically just a descriptive overview of what these patients look like that are hospitalized in the U.S. Something that was done more locally was one of our faculty and several of our residents teamed up to look at the West Virginia Trauma Registry, and they were interested in falls, pediatric injuries, and bicycle from bicycles and ATVs. So we compared helmeted and unhelmeted patients and then looked at their individual injuries to see, where the differences were. And so those were published in the West Virginia Medical Journal in a very short time frame. These were done, I think, in maybe a period of 6 months from beginning to end. And then, of course, primary data collection, which definitely takes longer, but it is possible. We had one of our physicians want to send out an email survey, so we created a survey, sent it out through SurveyMonkey, and had different pictures of EKGs and asked the physicians on the listserv to detect which ones had LVH. And so he's currently writing up the results and about to submit that. Another one of our residents sent an email survey about residents' experiences with ultrasound during the course of their residency, how they feel about it, what kinds of training they received. And she sent that to just some relevant listservs and asked people to forward it on to other people that might be interested in taking the survey. And she had, I think, over 350 responses in like maybe a 2-month period. So it really took off. And she's currently writing up those results and about to submit that as well. And in terms of primary data collection, both of these 3 projects, we utilized the Academic Associates Program. The first one was Steve's project, and he was interested in developing a new stroke awareness measure to see how patients in the emergency department, how aware were they of stroke warning signs and symptoms, and to see if we could come up with a measure that really could be given to the general population and patients to see how well people know these warning signs and symptoms. And so in a period of maybe 2 or 3 months, he got about 400 responses to that survey. And then these 2 are ones that I was the principal investigator on. The first one looking at the relationship between life satisfaction and satisfaction with care in the emergency department, and then another one looking at intimate partner violence, substance use, and health in ED patients. So I think over the course of 1 semester, all 3 of these studies, we had almost 800 responses. And so this model for data collection in the emergency department that we have has shown to be a pretty successful one. And there's nothing to say that in future years that it can't move on to include people in other places throughout the hospital, not just the emergency department. So that's something that's ongoing. Residents and faculty are definitely welcome to come and talk with us about maybe getting a protocol implemented within this program, because we're always looking for more. And I think that's about all I have to say. So if you have any questions, feel free to email me.